Twice a week, Mahdi Sharafuddin takes bunches of condoms, lubricants and rapid HIV tests and heads out into the Beirut night in this medical van. The destination tonight is Dibaya Marina in East Beirut, one of the city's cruising areas frequented by gays and sex workers.
We do some awareness for HIV/AIDS and other STDs. We try to convince some people to get tested.
Lebanon has relatively low prevalence in HIV/AIDS, with under 1% of the total population infected. But healthcare workers say the country's undergoing a sexual revolution. More sex is happening before marriage, with multiple partners and with partners of the same sex. And they see a large jump in infection rates on the horizon.
Lebanon is having its sexual revolution in the midst of the AIDS pandemic, of the HIV pandemic. So it's not fun.
Also, the makeup of those at risk is shifting from a mostly straight population to a gay one.
Now with the growing number of cases that we have, especially in the gay community, I think now we are at the stage actually where people are starting to be scared.
Infection rates among gays in Lebanon have almost doubled annually for the past 2 years. Now, nearly half of all new infections involve men who have sex with men.
The people who are catching HIV are relatively young. They are in general people less than 25, so they didn't get out much to understand all the details about HIV.
When it comes to informing these people, the Ministry of Health and its National AIDS Programme have their hands tied in a certain respect. Homosexual acts are illegal in Lebanon and the society is, largely, a morally conservative one. So issuing public awareness campaigns specifically targeting men who have sex with men is problematic.
The thing is that the gay community does not identify with the campaigns available.
And that lack of targeted public health information is compensated for ad hoc through graffiti on the walls of the city. This stencil warns of the dangers of barebacking, that's having sex without a condom.
There's a lot of ignorance about the subject. I have been through experiences where the guys don't even know that what is the use, or sometimes they would say it loses all the fun of it.
The government's HIV/AIDS programme is almost entirely funded by the UN and the World Health Programme. It agrees its priority must now be to target high-risk groups such as men who have sex with men. But it says that the best way to reach such high-risk groups is indirectly through NGO partners such as Helem.
We need to have people among them who will work with us, try to find out the most essential way, the most effective way to intervene and to convince those people to adopt safe sex behavior.
Dr. Mukhbat of the Lebanese AIDS Society says this model is a policy cop-out. The only way the government can properly tackle the emerging crisis, he says, is by first decriminalising homosexuality.
NGOs don't solve the problem. It is a strong state. And the change of the law is essential. Because for the state to be able to access, we have to be able to change the law.
Until a change in the law happens, Helem and a handful of other anti-AIDS NGOs are finding themselves more and more at the forefront of Lebanon's fight against AIDS. Mahdi's bi-weekly nocturnal jaunts will continue, but he's hopeful.
I noticed that, some people have changed their minds. They corrected their wrong information. They're now trying to use the condom to have protected sex.
But his work is stemming a growing tide. He's been doing this since January and says he's only had 2 positive HIV results in his van so far out of 200. Unfortunately, all signs suggest he may soon see many more.